Now, into the small intestine. This we sort of already talked about, right? So we have mixing movements, segmentation movements, and then we have peristaltic movements. Normally, motion through the GI tract is about 1 centimeter per minute, or about 3 to 5 hours from pylorus, end of stomach, to ileocecal valve, start of large intestine, right? So that's the typical transit time. Now, it can dramatically increase. If you look at the bottom one, irritation of the small intestine will result in what's called peristaltic rush. The easiest way to describe this is when the intestine is irritated, it tries to empty itself as quickly as possible. This is one of the causes of diarrhea, right? Because if you move material through the GI tract really fast, there's no chance for reabsorption to occur. So you get a lot of material, you get a lot of feces with a lot of water in it, right? So that's our peristaltic rush. When people talk about like crampy abdominal pain with diarrhea, this is what they're experiencing, is this peristaltic rush, okay? Now, small intestinal motility is affected by a lot of things, right? So gastrin, CCK, insulin, motilin, and serotonin, yes, serotonin, like same from the brain, all stimulate intestinal motility, right? This serotonin is one of the reasons why the serotonin affecting medicines are used in like irritable bowel syndrome, for example, because if you change the serotonin dynamics, you can reduce some of that stimulation. All right, so those are all stimulators. Secretin and glucagon. Secretin is released from the duodenum, and its biggest role is to increase bicarbonate secretion from the pancreas. All right, but it also slows everything down so that that bicarbonate has a chance to do its job, which is to neutralize the stomach acid. And then glucagon, remember glucagon is the hormone that works opposite to insulin. Okay, insulin drives sugar into cells and therefore lowers your blood sugar. Glucagon tends to produce glucose or generate the production of glucose, and it tends to raise glucose levels. And glucagon is an inhibitor. We'll talk more about glucagon when we get to our endocrine chapter. And then we've got a bunch of reflexes. We talked about some of these yesterday, like the gastroenteric reflex. If we put food in the stomach, the intestine wakes up, right? Because that makes sense. The stomach's going to have to empty. Where's it going to empty to? Into the intestine. So the intestine needs to have moved its stuff to prepare for that. So we have our movements of the small intestine. What this is showing you is just simply that there are lots of different patterns that we can see. You know, remember, we got a whole brain in here, right? The enteric nervous system has a lot of options for making things move. So you can have nice regularly spaced contractions. You can have a contraction in just one place, like if we're doing peristalsis. They might be irregularly spaced, or they might be weakly spaced. In other words, you got all the possible options. There's not just one way things move through the gut.